Welcome to ARC Pediatrics. In this video, we'll cover all the information you need to know to make the right healthcare choice for your newborn, and we'll review what to expect in the hours and days after childbirth. With ARC Pediatrics, our pediatricians work as a team, so you can count on 24/7 access to connected care. Our regular office hours are 8 a.m. to 5 p.m. Some clinics may even have earlier appointments available. During the day, we save slots for same-day visits, so your child can see someone from our pediatric team for urgent issues. During nights, weekends, and holidays, we have pediatricians available at our after-hours clinics for illness and injury visits. At any time, day or night, you can reach a nurse or an on-call ARC pediatrician. Sometimes we can diagnose an issue during a video visit on your smartphone. Our video visits work best when a physical visit isn't necessary, for example, a rash or pink eye. On the rare occasion, often during flu, cold, and RSV season, when it may be difficult to find an appointment, you can book a 24/7 virtual urgent care visit with an ARC pediatrician on the Norman MD app. This requires a fee if it's not covered by your health plan or employer benefit. We all know parents are busy and need easy scheduling options when seeking care. You can book most appointments on the ARC MyChart app. You can also book directly from your doctor's bio page at austinregionalclinic.com. When booking an appointment for your newborn, use arcnewborn.com. Of course, you can call 24/7 to schedule those appointments too. The information from every visit is shared between all of our ARC colleagues. And we share it with you as well via ARC MyChart, accessible online or via our app. When you sign up for proxy access to use your child's MyChart account, you can book appointments, review the appointment summaries, send non-urgent messages to your child's doctors, request refills for medications, review your child's growth charts, view and share their vaccine records, complete necessary forms, and so much more. Our patient portal messages are only for non-urgent questions. If it's an urgent matter, especially about your newborn, we prefer that you pick up the phone and talk to our 24/7 phone nurses. We are here if you ever feel worried, just pick up the phone. To give you flexibility, we use the same electronic record system throughout our organization. That continuity helps us coordinate your child's care across all locations, doctors, and specialties at ARC. All of our clinics have an on-site lab, which makes lab work at the time of your appointment quick and easy. Many of our clinics also offer on-site or nearby radiology services, often without having to book a separate appointment. Now that you know all about our 24/7 access to connected care, let's talk about how to prepare for your newborn's arrival. Beforehand, take the opportunity to tour the hospital. Pack your bag with whatever will make you more comfortable, maybe a pillow or your favorite music. After the delivery, a pediatric clinician at the hospital will examine your baby daily. You will have access to lactation consultants who can help you adjust to breastfeeding if that's what you choose. You will hear your pediatrician use the term cocooning when we talk about the first few months after bringing your little one home. Cocooning means you keep your baby safe by surrounding them in a layer of protection. We recommend avoiding face-to-face contact with children and people who are not vaccinated against whooping cough, aka Tdap, flu, and COVID. This protects your baby against those illnesses. We all strongly believe in the power of vaccines as recommended by the American Academy of Pediatrics to keep your child and your family safe, healthy, and alive. Vaccines have practically eradicated diseases that children used to die from or that damage them permanently, like measles and polio. When an unvaccinated child is in our clinic, they can put others at risk. If parents decide they don't want recommended vaccines for their baby, we might not be the right pediatric group for you. There are some recommended vaccines and screenings your baby will receive in the hospital. The first one is the vitamin K shot, usually within the first few hours of being born. We need vitamin K to make our blood clot if we start to bleed. Babies are born with really small amounts of vitamin K, so a single shot at birth protects them from dangerous bleeding situations. The other important shot is the hepatitis B vaccine, typically received within the first 24 hours of life. The hepatitis B vaccine protects your baby against chronic liver disease and cancer. You or your family members might have hepatitis B and not even know it. When you get close to discharge in the hospital physician will determine when the baby should be seen for the first time in the pediatrician's office. Then you can go to arcnewborn.com and book a newborn visit with your chosen ARC pediatrician. You can also call 512-272-4636 anytime to book your newborn visit. We recommend you book the appointment before you leave the hospital. We prioritize newborn visits because it's particularly important that we see your baby within 2 to 3 days of their discharge from the hospital. We will send you an appointment confirmation text 24 to 48 hours before your newborn visit. The text includes a link allowing you to register the baby with ARC. You can register by phone if you prefer, but it's quicker and easier to register electronically. If you come to the visit without first registering your newborn, it can take an extra 30 minutes. This map shows you where all Austin Regional Clinic offices are located, and we continue to add more clinics. The ones with the red dots are our after-hours clinics. That's where you can schedule a visit for illness or injury on weeknights, weekends, and holidays. When you check in at the clinic, you'll wait in the well-child seating area to keep your newborn safe. One of the services we have found to be most in need during the first few weeks of parenthood is breastfeeding help. ARC partners with the Breastfeeding Success Company to provide education, classes, and support for lactation during your hospital stay and after your discharge. They are in network with most major insurance companies, so your insurance plan may cover most of their services, leaving you with little to no out-of-pocket costs. Your health plan may even cover a breastfeeding class, a birth class, or infant safety class. We will email you additional information with a link to our newborn booklet. This booklet is a handy guide to things parents have asked us through the years. If you have the Baby Scripts app, you can access it from there as well. Coming up next, you'll get the option to meet some of the pediatricians and APCs in the ARC clinic nearest you. Our pediatric teams at each clinic will also answer any questions you may have about how to establish care, newborn feeding plans, family vaccines, circumcisions, and more. To join a breakout session, select the breakout room icon. You may need to click the 3 dots icon to access the option to join a breakout room. Next, choose the breakout room of the clinic closest to you. If your clinic is not available tonight, stay in this room and we can answer your questions. You can also leave a breakout room at any time and join another if you'd like to meet the pediatricians at another clinic. You can select Leave the meeting when you're done, and we'll stay in touch via email.